Perfect. We'll get started into it. So we'll start off today with an acknowledgement of country. So we recognise that we are hosting this webinar from the country of the Gadigal of the Eora Nation and the Wadawurrung of the Kulin Nation. We recognise the traditional owners of the countries and where we meet today, and any First Nations people present on this webinar. We pay our respect to elders past and present, and celebrate the diversity of Aboriginal and Torres Strait Islanders people and their cultures and connections to the land, waters of New South Wales and Victoria, where I'm based in Victoria and Jess and Erin are based in New South Wales. Amazing. So we're getting into the fun stuff now. So obviously for today, we've obviously touched on, we're going to be looking at relocating to Australia and all the things that you need to know. We already mentioned the chat and already mentioned the Q&A. So we'll just touch on what we're going to cover during the webinar. Then after this slide, we'll do a bit of an introduction to myself, Erin and Jess. So essentially from the top, we'll be looking to introduce our team at Prospero, why you might look to partner with Prospero for your journey down under. We'll look at the community support that we offer, the holistic support, the work opportunities and everything that encompasses that. And what we want to do is get to know you on that individual level, which we spoke about, learn about your preferences, give you tailored advice for the work opportunities that you might want to consider with us or just down in Australia. And that really is what sets us apart at Prospero, is that individualized personal touch. We will touch on what you need to know to relocate to Australia. That's obviously a really big one. There's a lot of legalities or compliance requirements that you need to make sure that you work through, and we'll touch on stuff like APRA and everything down here, references, CV, all the things that we need as a business to support your journey. We do just need to disclose as well that Prospero Health and Social Care, we're not a licensed migration advisor, so we can't give you specific visa advice, and we recommend going to the Australian government websites, which we'll share some links throughout the webinar itself, and we'll talk a little bit later on about a registered migration partner that we have that we can refer you on to, called the Migration Agency. But a lot of people might be on the working holiday visa, which is a lot more simple, and you don't need to worry too much about going to Migration Agency if you're on the working holiday visa, but we'll touch on that later. We'll talk about APRA. Jess will run through this and how to apply for APRA. Then Erin will go through about where to live in Australia, and then when you can arrive as well. And then the types of roles that are available. Obviously, as we mentioned, we're looking to focus on the hospital settings. So areas such as like acute, ICU, ED, oncology, midwifery and everything. And there's a huge staffing shortage in healthcare in here in Australia. So get excited, there's a lot of work. And then from here, the next steps in your journey as well. So as I mentioned, 60 minutes, we'll try and cover everything as much as possible. If we quickly go through a slide, it doesn't mean it's not important. It just means that we have to cover a fair few different topics. But the goal of today is that we've introduced most of the topics that you'd need to know about making the move, at least the really important ones, and then all the finer details we'll be able to support you with in the follow-up. So that's in a nutshell. Hope everyone's excited. We're definitely excited to see. We've got over nearly 40 people on the call, which is great. So it shows us a lot of interest, which is really good. So now we'll start off with a bit of an introduction, and then we've got a few polls in this webinar as well. So we absolutely love polls here at Prospero, so we'll throw a lot of polls out at everyone. So, but just to start off, so my name's Tyler, and I'm the International Recruitment Manager for Prospero. I'm based down in Victoria in Australia, in a little surf town called Torquay. So if anyone gets down this far, make sure you come down, visit Torquay, and we can go have a coffee. I've got about 7 years of experience working within the recruitment space in Australia and New Zealand and in the UK. And I'm originally a secondary PE health teacher. I don't come from a healthcare background. I'm from a teaching background. And over the past 6 months, I've started working within the healthcare recruitment space with the awesome people on the team, such as Jess, Erin, and the rest of the guys on the team. I'm lucky enough to have lived overseas before as well. I lived in the UK from 2016 to 2020. So doing the reverse of what a lot of people are doing on the call. And I'm absolutely passionate about helping people make the journey overseas. The trip myself was one of the best moves I've personally ever done, making the decision to move overseas. So really passionate about helping people make that same journey. And really excited to, support everyone on this call. Hopefully we can make it happen for your trip down under.
So my name's Erin. As you could probably tell by the accent, I'm from Ireland. So living in Dublin. I am over here 5.5 years now. So originally came over to Australia on a working holiday visa. Time does fly. I'm 3 years in recruitment. My background is health and social care. So I have been with Prospero Group now coming up to 1 year. I am the recruitment consultant for the acute care side. So working alongside nurses, placing them in roles across all states. I do specialise in Northern New South Wales and Queensland.
My name is Jessica. So thank you very much for taking this time for us and join us in this webinar for your future journey in Australia. So my experience is in health and recruitment for the last 12 years. I'm coming from Europe. Probably you will feel some accent there. So I'm Spanish. So from my experience coming to Australia was our journey as well. So yes, I hope that you have all information. You can get all information we can provide to you today. And yes, so welcome to the webinar.
And then Jess, yeah, a little bit of introduction about us as a business and why Prospero.
Well, Prospero is a big company. It's a global company working in different countries. So we have experience more than 20 years. We are focusing two main industries. One is health and social care, what we are going to discuss today, and also as well in education. So just in UK, we have 12 offices. We have the branch here in Australia, and we have the branch as well in New Zealand. So as a global company, we understand how is the change or moving into another country, how is the procedures, policies, paperwork to get ready there. So we are quite, connected between branches. So even if you're working already with Prospero in UK or Ireland, so we are happy to transfer as well your profile here with us, and we do holistic support. We do from the beginning that we do, how is the paperwork, what is the plan, how to guide you through every single step in the selection process. And as well, when you are selected as well, we help you, how to organize your plan, your travel, how to organize your accommodation. And we guide you after your placement as well to see how is your, how you establish in the country as well. Those services are completely free. So I want to make sure that everybody knows that we provide, this consultation because we believe that if we support you, you enjoy the journey, and obviously you will be happy with the service, and you will recommend to somebody else as well. So for us, it's really important to mention that we support you all the way because we want you to grow with us, and as well to make sure that the best service, we can provide the best service, and you can recommend to another of your colleagues. Also as well, this is a company that even if it's global, was starting from, it's a home family company that started, how I say, 20 years ago. So we understand how is to start in the beginning, grow, and become, global. So yes, pretty much is what we are. We are personal service, and we provide all holistic support from day one until the last day.
Amazing. That's probably one of the biggest ones, that holistic support as well. So we want to make sure you know all the things you need to know, whether it goes from opening a bank account, where to live, how to meet people, connections, where to find accommodation, all those sort of tips and tricks that we can give for the move. But obviously at the core of it, obviously, is finding new work and employment too. So that's that holistic support is definitely a big part about what we're about. But Jess, why would people want to move here though? Give us a scoop. So why did you want to move here, Erin? Why did you want to move to Australia?
Well, I can speak, like a expat as well, I'm from Spain. So when I moved to Australia, I was like, well, Australia is in the other side of the world. It's quite scary, isn't it? But, there are many positives coming to Australia. And you can travel and work for those people who they are looking for with working holiday visa. They want to see the experience, they want to try, and later, maybe to decide to stay, in permanent basis. So obviously they are, Australia is giving you options to work at the same time that they provide accommodation to you. We will talk about this later, but you can travel, work in what you love, and in the same time you have support from different companies, hospitals in this case, where they can give you the option to free accommodation or even reverse travels. So you can travel, discover the country, what is a massive country. There are different things to see, nothing compared one state to another state. So definitely that is a reason to come. Culture, well, they have a massive culture. Wherever you go, you feel that. So obviously you go more remote or regional, you will feel those communities, Aboriginal communities, they are well welcome. And also as well, they can give you, a different touch of how is, the culture, Aboriginal culture here in Australia compared to how is the culture in Europe, for example. It's completely different, immersion, different approach. Very involved with the environment. So really worth it to see how is Australia in that aspect. Personal growth. Well, Australia is growing always, and basically it's a good country to build your career, to develop your career. So definitely there is many opportunities, especially for nurses or midwives, because the shortage of the country is giving you the opportunity to develop your career quicker, to learn skills. They support you as well in that training to develop your skills more and more, to the point that you can grow quicker compared to, for example, in Europe, that maybe, the process, all crises, rates, things like that, budgets, so they can stop a little bit that grow in that kind of, speed. Lifestyle, well, look, we have sun. We have sun, we have beach, we have, good style of life. So yes, maybe some people care, oh, it's a little bit expensive, housing, or a little bit expensive. It's are really good. And compared to some countries in Europe, also as well, you're living, all main hospitals as well, they are as well by the coast. So you have that kind of lifestyle, work-life balance. Many the private hospitals as well, they support with well-being programs. So yes, it's good quality of life. So you have your son, you have people that are very involved to do hiking. There is more opportunities to do, quick travel around the country. Really, really good lifestyle and work-life balance. And if you're coming, for example, in permanent basis, with your family, so the kids, they have many activities as well, with the schools outdoor. So it's really different style compared to Europe in some space, and actually is, good life balance, I would say. So yeah, pretty much is that. Travel, sun, beach, good opportunities to develop your career.
So the next few slides will touch on your journey timeline. And the biggest thing for this, same as everyone's motivating factors for wanting to move overseas, everyone's journey is unique, and we can't guarantee the timescales on the next couple slides, but we can give you some rough guidance on what to expect. So your journey will likely look different to what we present, but it could be thereabouts of what you could expect. And just an example, like if you're eligible for working holiday visa, which we'll talk through the visas shortly, the time frame might look quite different to someone who's going on an independent visa or a sponsorship visa, as an example. So there are some differences there. So and then different applications take different times as well. So, but we'll talk through that all in this next couple slides.
Australia is a country of opportunities, but for that you need to plan, the key steps in your journey. So obviously there are 4 main points in this slide that we want to discuss. So obviously the compliance is we have some minimum documentation that you need to prepare before to start your journey. And obviously we have, that support for you as well. We give you a checklist of documents that really you need to prepare with time frame as well. So that can give you an idea, okay, well, I'm planning to move in the next 6 months, or no, I'm planning to move in the next 3 months. Depends as well, what is your journey? If you're traveling in permanent basis, obviously can take a little bit more time, because you need to organize not just yourself, probably you need to organize as well the documentation for your family traveling to Australia. But if your journey, for example, is, as a working holiday visa, just in trying for a few months, 1 year, 2 years, because some countries, they have that kind of possibility to work for more than 2 years as well with a working holiday visa. So yes, so that is going to give you a time frame with that checklist to say how I can organize myself and what documents are the main ones. So let's start for the first one, immigration. So if you're deciding to work, in permanent basis, well, you have to evaluate, what kind of skill visa sample you want to apply, or if you apply for the sponsorship through one of our clients. So that is going to take a little bit longer. We are talking about, few weeks more, or 6 weeks in between 3 to 6 months. If, for example, you're looking for to work in temporary basis through a working holiday visa, to apply, can take between 1 to 8 weeks. Depends of the visa. Is something that later Tyler is going to disclose a little bit longer. But yes, each person is different, each situation is different. So we can do a follow-up later on, with our consultants. What is the option for you? What is your preference? And we can go from there. The most other important document, what is APRA? APRA we will discuss later on what it is, but APRA is basically the license to practice in Australia. So you will need minimum documents for that. Pretty much is your transcripts, pretty much your 180 points, passports, and information about your statement of service. So that is the main document. Will not take too long. If especially I recommend not to apply through the month of May, because all registered nurses and midwives, they renovate their APRA here in Australia by the 31st of May. So if you're planning to apply for that APRA, please don't apply on May, because it can take longer than 8 weeks or even longer than 10 weeks. So if you're planning to move in the next 3 months, will be a little bit challenge not to have license to practice, because all the clients, they would not set your profile if you don't have the license first, even if you want to apply for the sponsorship. In regards to the other document that you will need is as well the police check. Probably you will have a police check, in your country, but we would highly recommend to apply online for the federal police check. That can be done online, but you can do that when as well you arrive to the country. However, can take only 2 to 6 weeks, depending on the name. Sometimes if it's a very popular name, can take a little bit longer, but those ones are the main documents that we will need to identify what kind of visa you want to apply, or what plan you have if you want the sponsorship, have the license to have, to be able to apply, because if you don't have license, you cannot practice, and clients will not see your resume if you don't have license, and police check.
Cool, Jess, and we'll keep on smashing through on the journey timeline.
Yeah, well, thank you, Tyler. So yes, basically what we do is we start with a consultation call. So obviously we need to know what is your preference, as we mentioned before. Are you planning to move in permanent basis? Are you planning to move, in a contract? Or what is the plan? When we know really what you're looking for, we will guide you. Well, these ones are the main documents. If this is the plan that you want to do, moving in permanent basis, or these ones are the documents that you will need, for working holiday visas. For example, if you're planning to travel around Australia and just to move in temporary basis. I suggest to don't apply before than 3 months. The reason behind is if you're ready to go, you have your working holiday visa, is perfect. You can apply for jobs to move in the next 3 months, but the jobs are coming constantly and they're changing constantly. So if you apply in 6 months, probably it's not going to be the same job. And obviously due to the shortage that we have in the country, so the hospitals, maybe they can need that kind of a specialty, but maybe they don't need that specialty in months later. So that's why the time frame for 3 months before to travel would be the perfect one, because it's still now those clients or hospitals, they can wait for you to arrive if you pass the whole selection process. So that's why it's the consultation to know what you're up to or what you want to do. Compliances is the second step, obviously, after we know really what you're looking for as well, as of travel and move to Australia. So we go through those documents that we mentioned before. Again, within the period of time of 3 months, because we understand that you are applying for your APRA first. Obviously, we discuss what is going to be your visa, or if you're going to need a sponsorship, and what documents you need to start to apply or present or collect to be able to start those, to present the minimum documentation to the hospitals when you apply for those particular roles. Obviously, we will identify what kind of roles. So we go to, obviously, the next step. So we identify through all these calls what is the preference, what you're looking for. If you're looking for a senior position or a junior position, what specialty, if you prefer metro areas or you prefer to work in regional. So later on, Erin is going to explain what are the benefits working in metro or regional areas, or what is the preference, what is the benefits as well to work, with private and public. However, when we identify those vacancies, so we guide you, well, these ones are matching with your preferences, these ones with what you need. So we forward your profile to the client. We present a briefing that we discuss with you. And we suggest to present your profile to different hospitals, matching obviously and discussing with you which hospitals are. And yes, we get the feedback from the client. Yes, we go ahead for an interview, and we organize the interview between you and the client. What will be the hospital? Normally it can be the NAM, normally it can be the clinical specialist in that unit, or even the facility manager. So we can actually arrange that interview with you and the client by Zoom, by Teams, because we understand that, obviously you are still now in your country. So we prepare you for the interview, so don't worry. We give you tips. We give you as well information about the hospital, about the unit, how many beds, what they are the skills required. We guide you how to highlight, you're not interviews, because we understand that maybe it's not something, that usually you do very often. So we guide you, we coach you how to highlight your skills based in what the role you are applying for. So you have better understanding how to sell yourself, all your skills and your knowledge and your experience to that client, so you can give in short time all your best in that interview. So so that is normally takes between 2 to 3 weeks from the presentation of the profile and confirmation from the client, in this case the hospital, to confirm that interview. And yes, and basically all of them, they would request minimum to have your APRAP at that stage. So some of them, maybe they can wait, until you get your visa, or you can get a possible sponsorship with them if you are selected. But yes, at least you need to have in that stage APRA, what is the license to practice in Australia. Step 4, so it's more like a focusing registration with us. So the interview, you are pre-selected. You are selected maybe at the end in a second round. Some clients, they request to have 2 interviews, but mostly it's 1. However, when you are selected, you start the registration with them, onboarding process, also with some documentation with us. We'll help you to fill all those documents. We understand that you're not familiar with those documents. And but yes, it's just to create your profile in their books. So basically to be able to work as a staff from that particular facility. So we'll help you in that process. Yes, and that takes around, will be in the period of time of 2-3 months before arrival. So the paperwork can take, depends of you. You have all information collected before, can take maybe 1-2 weeks maximum. And yes, we will arrange that documentation with you, and you will get a letter of offer from the client saying, well, you are selected. We want to offer you this position with these conditions and this salary base. So the next step will be coming to Australia. So obviously you got already your employment, you got already your onboarding process, that's basically to enroll with a client, with a hospital. So it's all done. So now we obviously organizing your travel. We help you to organize, not the flights, unfortunately, but yes, we can arrange, in some cases, the clients or hospitals, they provide provisional accommodation for who is moving in permanent basis, just to give you the opportunity to settle in the country a little bit before you find your own accommodation in permanent basis. And also as well, some of the clients as well provide relocation services. So basically they assist you with, not with flights, but yes, with budgets to cover those flights for you and your family. So that it will be pretty much, you're packing, you are getting ready. You will have from us and from the hospital the contact person, where to go, where is your accommodation, start date, when is your orientation day and induction, when you arrive to the hospital for first time. All the information will be already there. And yes, so you arrive to the hospital, last step, and yes, we call you after your first shift. We want to know that you're happy, you got all support that you need. And also we call you, after 1 week, how is going everything? Do you have your orientation? Do you need more support? How is going, accommodation and things like that? And the last, month as well, we call you just to see if, well, everything is okay. We want to look after you. We understand it's a big jump from one country to another, and especially if you're moving with, family, can be quite challenging. So be aware that hospital as well supports in some cases, knowledge or even to help you to find schools for the kids. For who is traveling, for example, in temporary basis, well, again, you will have accommodation and, travel organized and everything from us with the hospital. So you don't need to be worried about that. Obviously, we will help you in the process, later on, how is, organize your bank, how it's organized your tax file number, and all these details that you will need, to be paid. So, but that is part of the registration that we do in the step or with the onboarding process with a hospital as well. And that's it. This is the journey.
So the next one we're going to touch on is just introducing the visas. So this slide and the next two slides, again, just want to touch back to what we mentioned before to say we're not a licensed migration advisor. So essentially, this is just high-level guidance. I'll share a couple of links into the chat just so you can go off and do more in-depth research. But it seems like a fair few people have already looked and mentioned that they're looking for the 186 sponsorship visa. So before diving into any of the specifics, it's essential you assess your eligibility for each of these different visas. And then I'll share a link into the chat, which everyone can use if you're not already familiar with it. It just goes on to guides around like getting a visa and what visa that you could be eligible for. But the top visas are sort of broken up into these top three. So working holiday visa, employer-sponsored visa, and then the independent visa, which is the skilled visa. And they, in Australia, bless, we have got it maybe a little bit complicated in one way to put it in terms of the numbers and the subclasses and everything around the visas. So if you feel like you're navigating a little bit of a minefield at times, don't sweat. Like there are a few things you need to learn about the visa process. So the working holiday visa is the 417 and the 462. And for a lot of people on the call, if you're under the age requirements in the UK, it's under 36, but it is an age-restricted visa, and people from the UK can apply for a third year, which is a new change. And just currently as well, Jess, correct me if I'm wrong, the 6-month employer rule is currently removed, so you can remain the same employer for longer than 6 months, which previously had been implemented. So that's something which, if you're from the UK, that isn't currently in place. So Jess, is it the UK and Ireland as well? Is it not just the UK? I think that's just across the board. Sorry, yeah, apologies, I've crossed my wires there. And then we touched on how long it will take to apply for that visa. But if you're eligible for the working holiday visa and you meet the age requirements and then the country requirements as well, where you're from, where you hold a passport, then it is a good visa to come over on, and it can lead to getting sponsored from an employer once you're here too. But if you are coming over and you are looking to get sponsored, then the two visas for the sponsorship visa is the 482 and then the 186. They're the two different subclasses. One of it is just the employer nomination visa, where you're employed directly through an employer, and the other one is a temporary skills shortage visa as well. Jess, do we have many clients doing either one, the 186 or the 482? Is a bit of a mix.
We have a big of mix. We have a mix, but it's good that depends as well of the years of experience and as well the specialty, because obviously the country is really short in emergency and ICUs, for example, or midwives. So in those cases, some clients, particularly some public hospitals, so in New South Wales, so they can nominate for PR. What is the 186? I can see here in the chat someone is looking for that. Well, depends as well of the experience, depends as well, the specialty. Some clients, they don't want to wait just to do a temporary sponsorship. What is the 482, 486? They want to nominate directly for the PR for that particular candidate. But there are particular situations. It's quite exceptional. So the most common is 482, 486.
Okay, perfect. And then looking at, so that's the employer sponsor. The other one is an independent visa, the skilled visa. So if you did want to go down that route, that's the 189 and the 190. And that means you would do that application. It does take a fair bit longer at times comparatively to the employer sponsor, but you're not tied into a specific employer through the skilled visa. And then the migration agency will definitely assist you with that, because it is quite a lengthy process to go through. But once you confirm your eligibility, the migration agency can assist you with those steps in that process. And then there weren't any students on the call, so we probably don't need to touch on the student visa or the postgraduate visa, but there are pathways if you were studying to have a student or postgraduate visa as well. But there wasn't anyone on the call who was unless Jess, you wanted to introduce it.
Well, a student visa, I mean, we have some people that maybe they start with working holiday visa, they pass all extensions and they want to stay still in the country, but they need to have minimum 4 years in the country to apply for the PR. And if they don't want to go through, nomination of another hospital for PR, what is exceptional, as mentioned before. So some of them, they decide to go to the student visa. So if you do, for example, master here in Australia and you finish your master's, so you will get the postgrad. So basically you can work full-time, not restrictions. But if you work as a student visa, you maximum of 48 hours fortnight that you can work. You cannot work more hours than that. In regards of, I can see one quick question about can you apply for the PR, the permanent residency, after 6 months with the 482? Normally, no. You have to be minimum 1 year to be able to apply for the PR. Normally, the client, the hospital, assists you after to sponsor you for 1 year because they want to create that kind of retention and to keep you here in the country as well. But yes, after your 482 minimum 1 year, so they can help you to apply for the PR, but normally you have to be minimum 1 year to 2 years.
Perfect. And we've got about 20 minutes to go as well, guys. So thanks everyone for keeping engaged throughout. So yeah, we've got a fair few more slides to go through. Might have to be a little bit prompter on some of them as we get towards the back end. So but just quickly on this one, so just an overview of the checklist. So just familiarizing yourself with the Australian immigration laws, gather all the necessary documents that you need, and I'll share a few links after I finish up on this slide when Jess jumps onto the next one about APRA, just so you can go off and have a click through to some of the AusGov websites. Seek advice if needed, if you're going through the sponsorship visa or the skilled worker visa. Definitely will connect you with the migration agency. You don't necessarily need to do that through the working holiday visa, and just understand your eligibility, and then plan your arrival with your visa approval, of course, is a really big one. So make sure you're factoring in the visa application when you're looking to arrive, and make sure those two things line up. But we can give you support with the guidance of the arrival times and everything. But just make sure with this, do your research. We'll do our best to support, but this stuff does fall out of our hands, the immigration side of things, but we can support and give guidance, and the migration agency can give you tailored specific visa advice. So perfect. Jess, APRA, one of the most important steps alongside the visa for working in healthcare in Australia.
So APRA obviously is the license to practice in the country. So this is one of the first documents you need to start to apply for. So how I said, depends on the season when you apply, can take a little bit longer, a little bit shorter. Mostly the documents that they're going to ask you is basically to have obviously your passport, to have your 180 points, what normally can be, you know, any documentation that proves your identity. And also as well, they are going to ask you your start date of service. You need to prove that you have some minimum experience as working as a nurse or midwife. Depends on the country, they request a minimum 1 or 2 years of experience. So also as well, if you have experience, not just in UK or Ireland, also as well, you have in other countries, they would request as well to do what they call ADMAC in some point as well, to apply for your visas later on, especially you're going to be nominated for PRs or you're going to be in sponsorships. So it's good that you apply as well to a MAC later on. What is a document as well to recognize your hours of service as a nurse in different countries. So that would be as well part of the documentation with APRA in some stage. But yes, mostly what they are asking you is to have all static of service, your bachelor degree. You have transcripts for that bachelor degree, or you know, just to prove what units can be homologated with the standards of the curricula that we have here in Australia. And also as well, how I said, the documentation for the 180 points, passport, and also as well to have, you know, you have any extra training or a specialty, you know, like some postgrad in emergency, or you did maybe a master in health or things like that, please add that information as well. So they will ask as well if you have any criminal records. So that is based in the police check that we were talking before in one of the previous slides. So, but yes, basically it's passports, name evidence, education. Obviously you have to have updated resume and a statement of service from the last 5 years, if it's possible, depending on how many years of experience you have after postgrad. And yes, basically to prove with, you know, the transcripts that you covered the practice enough that is considered enough to be able as a registered nurse. So there is some kind of differences. The UK and Ireland actually has more hours of practice when you're doing your bachelor than here in Australia. So you should not be in trouble with that. But if you're coming from other countries, probably they're going to ask you with those transcripts to show how many hours you have doing the practice to become a registered nurse in that particular country. Okay, so basically it's that. The information that you can see in the slide, passports, name, you know, if you are nominated or not, education, transcripts, signed curriculum, and also as well a statement of service that you can ask to your hospitals but it's basically a letter what says, how many hours you were working, in which base, full-time, part-time, and how many hours per week.
I just sent a link, everyone, a few links to the visas and to APRA as well. So feel free to have a surf through there, and then you can have a look at some of the documentation on the website and everything in a lot more detail as a part of the follow-up. But we have a really good guides and resources on, moving to Australia, and within APRA applications as well. That's a part of the process with us too. So awesome. That APRA link is in the chat for everyone. Back to you, Jess, I think. Sorry, is it for this one?
Yeah. Yes, I didn't know because I'm sound delay.
Oh no, sorry, that's okay. You jump in. All
It's
good.
not helping me the sound today. Okay. So yes, compliance is obviously, because you're gonna apply for APRA, you're gonna apply for your police check. So we want to give you a guideline, can be a little bit to have what kind of documents I had to do. You get lost in the process. So we send you as well. We have a compliance office manager who is helping us as well and helping you, to make sure that you have all information that you need. So the main documents are these ones. So obviously your resume has to be updated resume with referees. So we suggest, even to advise to your referees, we are going to contact them by email because we understand that maybe, with the different times can be quite challenging. So yes, we send them one template to fill up in regards of the reference checks. So we can prepare minimum 2, has to be your supervisors or managers, or cannot be under you, unfortunately, because otherwise we cannot really fill some kind of questions in that reference check that is actually reference check that they request, in clients. So our reference check is matching what the questions that those clients they request, those hospitals they request. APRA, obviously, to make sure that you have your APRA, but that should be first document no matter what. Qualifications and transcripts, because some clients, they want to identify if you are bachelor, if you are a diploma, what kind of level of experience, and that kind of thing. Working with children check. This is a document that you will need to do here when you arrive to Australia, so don't worry too much in a first stage. But working with children check is like an extra accreditation that you don't have criminal records. You can work with vulnerable people, especially with children. So for example, if you're working in pediatrics or you're working, in a midwifery, definitely you will need it. For some states, it's not compulsory, but if you work, for example, in New South Wales, Victoria, or South Australia, you will need it, or Northern Territory. The other document as well, birth certificates, is 100 points. So we were talking about the 100 points several times. So this is basically the documents that we are including in 100 points is passport, birth certificate, travel license. Medicare is basically you will apply for that when you arrive here. It's like a working with children check. So Medicare is basically just, your medical insurance. So it depends on the situation as well that you are applying for, in regards of visas, if you're planning to come in permanent basis, if you're planning to come, in temporary basis, probably apply for Medicare if you're coming in temporary basis. Probably you will need to apply for private insurance, but that is something that we can discuss case by case. And the right to work to Australia, well, passport, basically we want to know if you have the visa already or you are looking for the sponsorship. So that will be one document that we will need to have already. So when you pass the selection process with the hospital, they will request that document. So it's always good to have it in advance. Pretty much. So this is basically one application, one guideline that we will send you with ticks. So just to make easier the process as well for you.
Amazing. Thank you, Jess. And Erin's going to run the next couple slides, just focusing on choosing the right opportunity for you. So yeah, I'll throw over to Erin to go through like where you can work and then the private versus public sector as well.
Yeah, thanks, Tyler. So I suppose as the recruitment consultant, I'm lucky enough to work with nurses every day, listen to what their preferences are, where they want to go all over the world. So focusing on regional, some nurses prefer regional roles because it may offer that bit more of a slower pace of life, the opportunity to discover the country and embrace the culture while traveling. And then also you can tick off your regional days if you are working towards your next working holiday visa, if you wanted to go down that route. If you're doing a regional contract, you're guaranteed a roster. There is some preference on rosters as well. For nurses in regional areas, there's often perks, which include reimbursement of travel and then also free accommodation. Free accommodation is mainly in contract roles too. And I suppose as well, it's a great way to meet other nurses that are also in the same situation as yourself. And then touching on the metro, some nurses prefer to work more within the city, metro areas. So typically it does provide a bit more flexibility on shift patterns. There is a higher availability of casual and permanent positions in the metro. So I've been told from nurses that I do speak to. And then the metro areas might benefit with more kind of social aspects, as you do have more aspects to restaurants, bars, when you are located in the city area. And depending where you want to set up in Australia, you might feel a little bit more settled as you are working to and from your own home. So also touching on professional development and then opportunities. So basing that off regional roles. So public hospitals in regional areas, they're also known a little bit more to support professional development. So in Australia, we have a CPD, which is a continuing professional development. So it's based off points in metro areas. It can be a little bit more difficult to access, and there usually is a waiting list to get on this, access to training. And there is normally a cost involved as well. So regional roles as well. So it often involves that kind of broader clinical experience due to that kind of varied healthcare in the smaller communities. And then looking at metro then roles, so it does provide more kind of opportunities for skill development and then career progression as well. So private hospitals in the metro, they might offer more competitive salaries too, and then more employment assistance programs as well, and then really promoting that well-being and professional growth in the metro hospitals.
Amazing. That's all good on that slide. Yeah.
Oh, okay. Next
yeah,
one.
Sorry. Yeah, perfect.
Perfect. So we're looking at so public versus private. So I'm just going to go into a little bit more detail about private hospitals versus public. So what the benefits may be regarding salary, training, and then work environment as well. So looking at public hospitals, the salaries really are structured by a nurse's level and experience. So we do go off that standardized pay scale. With the public hospitals as well, we do offer both contract and permanent positions. The perks can kind of include that relocation assistance again, which I touched on earlier in the metro areas. So some of the relocation assistance can really start from 5,000 up to 20,000 relocation assistance. It really depends on the hospitals and what they can provide. Some hospitals can provide a retention bonus, so this can be offered yearly. So yeah, really trying to get them nurses to stay within the hospitals and grow and develop them as well. And then versing private hospitals, so salaries are usually paid above public scales in private hospitals. They can be negotiated often. They do offer permanent positions rather than more casual and contracts in private hospitals. And then I suppose they do, as I mentioned earlier, they do focus a bit more on the employment assistance programs and then that health and well-being. There is more kind of that fitness discounts, social discounts, entertainment. So yeah, private hospitals would offer more of a well-being promotion. And then I suppose training and development, relating that to public hospitals. So there is a bit more continuous training and development within public. Again, that CBD, so it does offer the extra training, refresher courses. I know some nurses might want to upskill within triage, so a lot of public hospitals can provide that too. Whereas private hospitals might focus a bit more on kind of intimate role requirements rather than the broad professional development. So again, looking at more wellbeing programs as well. And yeah, I suppose that work-life balance too, basing that on public hospitals again. So regional public hospitals provide a bit more local travel, reimbursement fee, accommodation, whereas private kind of offer that more range of perks, such as, again, discounts, health, fitness, promoting more of a holistic approach. And then I think we're just on the next slide then.
Amazing. Thanks, Erin.
Oh, good. So yeah, the types of work available. So yeah, at Prosper, we do work with a lot of clients, again, across all states. So it really depends what you're looking for. We do offer permanent positions, contract temp, or then ad hoc shifts as well. So permanent roles, depending where you want to work, it does include hospitals within regional, metro, the coastline. We have roles within Queensland, basing that off the sunny coast, Sunshine Coast, and then also Gold Coast as well, if you want to stay closer to the sun. And then we do also, it depends on your background as well. We've roles, so I know we're going to have a better look at our polls. So depending on the background, whether that be medical, surgical, theatre, midwifery, ED, ICU experience, in New South Wales, we have Western and Northern positions. They're more focused on permanent roles and contracts rather than ad hoc shifts. And then looking at the contract roles, again, that currently at Prosper, we do have contract roles with many hospitals. So it would be providing either fixed term roles or temp opportunities as well. Really depends on what you're looking for. Contracts are a bit more common with regional work. Again, this gives the opportunity to kind of have that work-life balance. And then ad hoc shifts, this may suit nurses with family caregiving responsibilities, those nearing retirement or maybe on a student visa as well. Some nurses like a little bit of a mix to do a permanent position and then maybe pick up a couple of ad hoc shifts just to try different hospitals, try a different experience. It really depends if you're looking, but if you are looking for more reliable shifts, I'd advise not to look at them ad hoc shifts, go for a bit more permanent roles or contracts. But yeah, there are all the types of roles at the moment available with Prospero.
Perfect. So good. And then when can people arrive, Jess? Thanks for that, Erin. That was right on there. But when can people make the journey down under, Jess?
Well, look, there are two main seasons to come to Australia. I would say from June to August, which is actually the European summer, isn't it? And later we have October to Feb as well, what will be our summer. So there's one option to chase the sun. That will be one of things. And then the other thing is because as well is when there are the holidays really in both different countries. So what happens is we increase the number of vacancies, we increase the number of specialties. So that is going to give you more opportunities to apply to different positions, give you more options to choose. And also as well, because we were talking about how to apply for APRA, how to apply, for some kind of documentation, you are not in the peak season. So for those documentations, preparing 3 months in advance. So give you the opportunity to get the paperwork ready to go quickly. And also as well, when you are ready, you are in the peak season when you have thousands of vacancies to choose for. So yes, so basically June to August will be the peak season and later on from October to February. For example, for midwives, we have the baby boom obviously from October. So but that will be definitely for midwives from October to Feb. But if you are in another specialty, well, choose both of those seasons. It's mostly when you're going to get more opportunities and clients are more open as well for the sponsorships or even for nominations of PR. So we have a special opportunity as well, if especially for people who they are looking for to work, in contracts, or even if you're referring a person who wants to move in permanent basis. But yes, if you refer a friend and is placed, with a minimum of 8 weeks in the placement, can be a permanent or can be a contract, we are happy to, to reward you with $500. We understand that you're better ambassador than anyone else because obviously you are in the industry, nurses like you, and maybe they're looking for a challenge like you. So yes, so we reward with $500. The only thing that we would request is basically to make sure that when you refer some friend, so you just send one email to us and info@prosperohealthandsocialcare.com.au. You mention who is your friend, so we know we can record in the data that candidate was referred by you, so we can later process the referral bonus. when when the candidate passed the 8 weeks of placement.
Amazing. Well, guys, we've pretty much hit the end of the webinar now, which is obviously sad to see everyone go, but obviously it's great that we've been able to work through, introducing a lot of topics, and we haven't deep dived on to so many because, you could do an entire webinar on, the 186 visa, and it would be up in here for an hour with our partners of migration agency. So the idea is always just to touch on all the touch on all the topics that you need to know. And then a part of the follow-up, which is this slide here, you can scan the QR code if you are nice and tech savvy, or if you wanted to send an email out to Erin or to Jess or to myself, of course, we welcome that. And then we'll look to get started on your journey, really. Hopefully, this webinar is giving you the insight into what you need to do, and then touched on certain eligibility criteria, but not gone into a lot of detail. So that will all form a part of the follow-up, of course. And essentially reach out. We want to get to know you on that individual level. I know Erin's already got a few calls booked straight after the webinar, so I know we already hit time as well. So we'll be nice and quick here. But this is essentially just a Q&A opportunity for everyone to ask any questions that haven't been answered. We might not be able to answer all your questions, so apologies if we can't touch on it just yet. It might form a part of the follow-up. But yeah, anyone feel free to post into the chat. I know there were a few questions around if you can apply for the 186 visa. So with the 186 visa, we'll essentially, and Jess, correct me if I'm wrong here, within the healthcare space, but we'll need to have your CV reviewed just to make sure you meet the eligibility criteria, and our partner, the TMA, can assist with that. And then from then, it does form on an employer offering you the sponsorship. So you can't necessarily apply for the 186. You need to be sponsored by an organisation within Australia. So that one, if you be eligible for it, you can go through that application process to receive a job for the 186 to get that sponsorship visa. Hopefully that answered a few of the questions that were listed before as well.
I can see another question about the contracts, the length of the contracts. Well, the minimum contracts are 4 to 12 weeks with possible extension to 6 months. So, and we have nurses, what they're doing is traveling to one place, doing the placement for minimum 12 weeks, maybe do extension because they like really the place, or maybe what they do is to travel to another location. The good thing you are doing those contracts, especially with public systems, some particular local health districts. So what they do is to do the clearance once with your paperwork, and you have clearance to work in every single hospital from that local health district. Just to give an idea, Western New South Wales local health district has 38 hospitals, so you can travel in those 38 if you want as well. So that is just to give you an idea how long can be those contracts. In permanent basis, obviously, is permanent. So yeah, that will be, the stay from day one. Normally they do, full-time permanent position with no expiry date, obviously.
Then Anne had a question around aged care vacancies as well. I know we've touched on mostly hospital vacancies, but Anne had a question: do we support within aged care, Jess?
Yes, we do. So actually, we have another recruitment consultant focused in aged care vacancies. So the aged care vacancies depends on if you have a lot of experience in the aged care space. Obviously, there are plenty of vacancies for new grads in Australia, but if you're looking for some sponsorship with aged care space, you will need to have a minimum experience, 3 to 4 years minimum. And yes, and some clients, big groups, they provide, someone like, for example, Salvation Army, Bupa, they will provide a sponsorship, but depends on each case. Okay, so if you're looking for that kind of working holiday visa, yes, it's easy. But if you're looking for a sponsorship, normally there are more sponsorships in hospital setting than in aged care as well. But yes, there are some clients that they provide.
There's a question how do
Yes, I
I
think.
contact you for further discussion? So that will be in the follow-up. So everyone will receive an email. Hopefully you already received one from us. And then as a part of the follow-up from here onwards, we'll reach out to you further again just to make sure we can get you find out more details about your plans and get feedback on the webinar as well. Like we want to learn how you've found this webinar, if you found it informative and everything. But as I know there's definitely a few questions here. We haven't touched on everything, just to really emphasize that. There's a lot more to learn about the move to Australia. So yeah, definitely reach out to us directly, send us an email, book a call here if you like. Hopefully Erin's calendar's not booking too much up for you, Erin, but hopefully there's obviously a nice full calendar for you to obviously speak to these amazing candidates for. But unless Erin or Jess, there's any of these questions that you wanted to touch on.
I just want to remind the QR code that you can see in the screen can give you the opportunity to book with Erin, personal interview, let's call it that way, where she can discuss, the different options matching with preferences and interests. So if you want to book, just read our code or send email to us. If you are not very tech savvy, no worries. We can just send one email to the email that we mentioned before, and with your resume, and as well your preferences to be called, and we can arrange, a Teams call or Zoom in the best time that is convenient for you.
Yeah, amazing. So I know a couple of people have booked into my calendar. I sent across a email to everyone. But yeah, if you haven't booked into my calendar, as Jess said, you can scan into that QR code and book in, and we'll do a follow-up call then. I can see some bookings coming in through now.
Nice. Well, perfect, everyone. Well, we know it's late in the evening, and it is a nice early one for us down here in Oz. But yeah, we're really excited to be able to catch up with all of you on the call. And yeah, essentially ask any questions in the follow-up. Really appreciate everyone taking the time out of your evening. And yeah, fingers crossed we can meet you down here in Australia over the coming months and years ahead. We know that the move might differ for everyone. Like it's not a move which happens overnight. Sponsorship can take a while. Finding the right place to live, the right opportunity, these things can take time. So yeah, definitely make sure you're feeling really comfortable with the move, and we want to make you feel comfortable for that journey and support you every step of the way. And it might be in 6 months, it might be in 12 months, or it might be in 18 months, whatever it is. There's always going to be a lot of opportunities here in the healthcare space. So hopefully you meet all the eligibility criteria, and then we can support that journey and find you the right role when you touch down here in Australia. So yeah, I think we could pretty much call it a morning/evening. And yeah, again, just thanks everyone for tuning in.
Thanks everyone.
Thank you guys. Thanks.
Thank you everyone for joining us.